Hi, and welcome back to Mindfulness, the channel where we try and open up a conversation about mental health in India. Today, we are joined by Dr. Sunanda Dutta, a clinical psychologist who works with older teenagers as well as adults. Her work involves individual, couples, and family therapy as well. Her specialization is in the area of domestic violence and substance abuse, but over the years, she has worked with a range of mental disorders. And thank you so much for joining us today, Doctor. It means a lot.
Thank you for having me over.
Yeah, thank you. So, Doctor, many people have been saying that lockdown has apparently led to good family bonding time. What are your views on this, and how do you think it affects people living in any sort of a household?
Well, on the face of it, it does seem like the pandemic has forced people to live within closed quarters, which one would imagine is great for family bonding time, is great for sort of, relieving the general stress because people are sort of staying at home, working from home, schooling from home and stuff like that. But what's been seen over the last many months, not just in India, but globally, is the effects, especially with young people and discordant families, is actually quite the opposite. It's been shown to have some very detrimental effects. There are people who are very frustrated, because of which the anxiety levels have gone up. So it's actually quite the opposite from what one might have imagined.
Right. So, if people are going through things like, as you said, anxiety disorders and the likes, how do you think we can help such people out?
Anxiety being one part of it, because my specialization has been in domestic violence, I've also seen that the amount of and substance use, I've also seen, as have a lot of my colleagues, a lot of our patients and clients have reported an increased amount of their family members having, abused and their intake of substance abuse and alcohol have gone up exponentially, as have the incidence of domestic violence and child sexual abuse. Some countries have reported as much as a 30% increase. Now, that's a very debatable thing. It's 30% and up anyway. So if you're talking about anxiety, depression, ranging to all the way to domestic violence, substance use, so all of these have gone up. Unfortunately, the rate of reporting has not been as high. One would imagine that it is because of, of course, the fear of the infection and things like that. But it's also, people sort of getting the support from outside. There isn't that much support, right? So in the sense that, so people do have anxiety, they are talking about it virtually through sessions and stuff like that. But there is really nothing, not nothing, there is very little one feels that they can do about. So I don't know if that answers your question.
Yeah, it does. So, lots of children who go through situations of violence at home may be afraid to report their parents, either because they're afraid that their parents will abuse them more when they find out, or even because of the fear of being rehomed. So what signs can we as outsiders look for to know that there's something unnatural or stressful going on in a household?
It's really difficult for us as outsiders to really know what's going on in the house, because one must understand that in the homes of where violence is very prevalent, it's not exactly something which is privy to outsiders. We're talking about, let's say, neighbors and stuff like that. So a lot of times, even if, especially in times of pandemic, you could hear your neighbor scream, or you might know that there is an incident of violence, or the children look disturbed, but there's really not much that one can do about it. However, to answer your question, what are the signs that one should look out for? Um, I actually just wanted to clarify your question. Are you talking about what are the signs that children need to watch out for? Like you guys would need to watch out for your friends, or would it be within the family members? What
I
specifically?
think both, so that like, everyone watching can help in some way.
Mm-hmm.
So we can start with children.
So okay, so with children, as far as their own family members are concerned, you would know that it's something out of the ordinary and that it would need to be reported if you see either one or both parents being very disturbed. Usually, it's the victim who looks very disturbed,
Okay.
and so let's say typically the mother would look very withdrawn, would get very irritable. Another way of identifying when abuse is done is, when you see a lot of bruise marks all over the body. So
Yeah.
these are all signs and symptoms where, wherein one might sort of call to attention. And so the other question being, how do we maybe help our friends? Similar signs such as, if we see a particular friend or a family being very withdrawn. Now, of course, this doesn't always have to sort of point to some sort of violence. It could even point to something like anxiety, or it could even point to something, which is like a long-term low mood, right? Which people loosely call depression. It actually might be depression, but the pandemic itself could bring about a whole range of, exacerbated or heightened mental struggles or emotional struggles,
Right.
which basically, to answer your question, if we are seeing anything out of the ordinary, so irritability being one of them, when let's say we hear of our friends and family members going through sleep disturbances, when we see them going through, either overeating or undereating, right? When we actually know or hear of incidents of maybe self-harm, or becoming harmful towards others. It could even mean their pets, right? Then it could be like a whole range of signs, signs and symptoms. It could also be listlessness. It could be hopelessness. It could be, lack of motivation, right? So all these are signs which, if you have alarm bells ringing, a good idea may actually be to delve a little deeper, for, if we notice it in people who we are concerned about, or if we have it within ourselves, to actually go out and seek either professional help, or if there is a trusted person, to sort of seek out their support, because it's very, very important to seek out support and not to keep it inside yourself.
Yeah. So that was about like domestic abuse and children being abused, basically, so for families. But in this generation that we live in, the statistics of partner violence have also gone up quite a lot. And can we expect this trend to continue during COVID? Because now that we're all at home, how would that continue? And do you think that it would still be on the rise?
Okay, so this is a tricky question, because when I imagine partner violence is, your question would be people who are dating, or would it be people who are cohabiting together?
Both. Dating, because that's the ones for which it's like, they're not living together. So how?
Right. So, abuse could actually be seen in many forms, okay? Physical abuse being one of them. People could get hit, slapped, punched, kicked. Then there is also emotional abuse, which of course is very, very hard to really understand, for the victims to understand that they are being abused, because it's so subtle. Yeah. Then of course there's sexual abuse, which is huge, especially in a country like India. People get married underage. You don't know, there's a very fine line between rape and even marital rape or dating rape, and abuse. In fact, even within conjugal, within a conjugal relationship, So that, and then of course there is financial abuse, right? There is mental abuse, there's financial abuse, in the sense one partner, it doesn't necessarily have to be the partner who's earning, but one partner has a lot of hold over the controls or the reins of the finances, right? So it's sort of you know, it's a very difficult thing to really report. But to your question about intimate partner violence, I assume that you meant partner meaning intimate, like, you know, a relationship, right? So an intimate partner violence, it doesn't necessarily have to be like a physical or a sexual abuse, right? So people, when they get into a sort of violent relationship, even when you're not staying in the same, you know, even if you're not meeting or for whatever reason, you know, you could sort of exhibit your control or your abuse, you know, that could sort of digress and move to, let's say, an emotional abuse, which of course is a part, it just becomes a lot more highlighted, right? Or abuse could be done in mentally, right? In so many ways. There could be a whole lot of threatening, you know, aspects, which actually earlier, pre-pandemic, it might have been exhibited in terms of either sexually or physically and so on and so forth. You know, so one of the studies, there was one study actually, which was done in the US, and which had some very, very interesting patterns. It's a little difficult to actually, you know, sort of have these sort of cases reported in India because there's so much of secrecy around, you know, our society around, you know, bolo mat and, you know, things like that, shame and guilt and all of that. But if we just follow the same results as the study in the US, which was actually done quite recently, what they showed is in a 2-month period, the number of reported cases for intimate partner violence, physical injuries, had actually gone down slightly. However, for the people who had actually reported these cases, the grievous injuries were exponentially higher, which are actually 2 times as high. So basically what they mean is that the victims would not call for help unless they're absolutely at the brink, right? So, you know, one might just hypothesize that a similar trend is really following in India, because our support system of helplines and such is not as sort of widespread as is in a lot of developed nations. And also, you know, like I mentioned earlier, the whole aspect of shame and guilt and all of that is just so much more, especially with, you know, couples who are dating. A lot of them, you know, the greater society doesn't know, parents don't know. So how do you deal with abuse, right? So one just might imagine that a similar trend follows in India. So
as you were saying about the same, in fact, I did this summer workshop one year where we helped out a women's self-help group. And over there too, you know, we heard people saying things like "Pati nahi marega, to kaun marega," and all of those sort of things. And in a society like that, you know, especially when going out is so much more difficult now, how can we expect people facing such situations to get help?
You know, right off the bat, I always encourage people to call helplines. You know, yes, friends and neighbors and trusted people are very important. But at the same time, it's a little tricky, right? Because the thing is, friends and relatives could also be somewhat biased. You have a lot of friends and family members who actually encourage people to stay on in the relationship for the sake of the kids, for the sake of how long the relationship has been going on for, so on and so forth. So yes, friends and relatives are important, and you know, they're a huge sense of support. But a great way of actually going about this is doing it professionally. So there are a whole lot of in fact, there are a couple of organizations that actually deal with domestic violence, you know, victims of domestic violence. I'll share some of these with you.
Yeah.
Right off the bat, it's there's a organization called JAGORI, which deals with JAGORI. The numbers are available online, and one could actually message them, and they will of course find out a more sensitive way how to call them back and stuff like that.
Right.
There's also SAARTHAK, there's Shakti Shalini. Then just moving a little away from the physical violence, there is also, like I mentioned earlier, there's also a very, there's an upswing of child sexual abuse. By child, I mean anyone less than 18.
Right.
So RAHI, they actually have their RAHI. They have, it's a wonderful organization. It's been on. It's been around for a very long time. They have their head office in South Delhi, and they do wonderful work. So RAHI is a great contact place, which is great for child sexual abuse victims. Actually, they also deal with adult survivors of child sexual abuse, right? So there are a whole lot of places available online, but definitely to try and contact some of these places. In fact, some of these places, from what I know, is in order to make the help a little more sensitive, is they've said that don't call, just send us a message. We will find out a way to reach out to you, right? So a lot of people, like, they can just do it in the middle of the night when they don't want to be heard calling. So they can just send a message and stuff like that. So a great this thing would be to contact some of these professional organizations that deal with these.
So I'll add the numbers of these helplines to the end of the video so that anyone can reach out. But how do you think that helplines are effective? Like, how do you think that they can help someone going through a thing?
So, what they do is, at first, they get in touch with the person who called. Of course, first you try and find out the authenticity, because there are a couple of people who just sort of, verifying for authenticity is one. Then assessment. So they do a detailed assessment on not just where you live, but the extent of abuse, and then the first line of what we call, let's say, treatment or crisis intervention would be to make sure that the person is safe to some extent, right? And then just give me 1 second. Give me 1 minute.
Right.
I'm a little busy right now.
But Mama, the dog
Can
is
you
starting.
close the door, please? Can I come in 5 minutes? Yeah, thank you. Okay, so sorry, that's my daughter. Okay, so where was I?
You was at the helplines conducting an assessment and making sure that.
Yes. Okay. So so can you shut the door, please?
Okay.
So yeah. So then what we need to see is that the person is safe, okay, and is outside of sort of being harmed. Their life is not a threat immediately, right? Because that is the first line of crisis intervention. So you might have somebody who's saying, like, oh, mujhe maar dalega, mujhe maar dalega. So the professional agency or the professional organization would be able to find out what is the degree of actual harm. So a lot of people may think that, they are going to die like right now. So they would ask them questions, right? And they would be, they have the expertise. So the counselors or the professionals would be able to have some very pointed questions that would tell them that, which is, I mean, how close they are to, being able to assess how close they are to having their lives in danger, or, having the children's lives in danger. Accordingly, based on their location and things like that, accordingly, they would sort of send out help and support and stuff like that. And ultimately, of course, there is group counseling, and, there is individual work, which comes at a little bit of a later stage. But the first thing to do is to make sure that they assess for harm and life in danger. So yeah, and also being trapped. A lot of people are trapped and they're not able to get out, right? So yeah.
Yeah.
So I don't know if that answers your question.
Yeah, it does. It does. Thank you. So I have one last question. So for many mental health professionals, one of the main clauses for helping a patient is that in case of any threat of harm to themselves or others, the patient's guardians must be informed. So how do you think that this is feasible for people living in violent households?
So are you saying that, let's say, the child is in therapy or in counseling?
Yeah, if a child
Okay, so the first thing to do is definitely inform the therapist or the counselor. Because if one feels that the parent is not able to protect, or if one feels that the parent is being harmed and the child is worried about it, so get in touch with the counselor or the therapist, and hopefully the therapist should have, you know, access to how to be able to help this child in terms of even giving their parents the numbers to call or calling themselves if they're old enough. Yeah, now this is a very tricky situation because a lot of times, you know, even though it seems like the most logical thing to do, a lot of times it would just seem like, you know, the person, let's say, typically the mother is being abused, so get the father arrested or, you know, get him to sort of, you know, many times it is so that, you know, the people actually don't want the fathers to be arrested or out of the house. So this is a very, very tricky situation. I think the best thing to do is actually contact the professional organization and you know, the organization could help the child or this concerned parent to you know, sort of to really how to sensitively go about it. I mean, even if that means a lot of times you know, giving counseling or help to the perpetrators of violence, right? So many times that is a way out. So you know, they really would be able to
almost started. So all right. Thank you so much, doctor. Thank you for joining us today.
Sorry, I'm in the middle of parenting duties.
It's all right. Yeah. But yeah, thank you, doctor. This has been very insightful.
All right.
Yeah, thank you for joining us.